I got a comment under one of my videos. Somebody wanted to know about hyaluronic acid. So this video is going to discuss hyaluronic acid and its possible benefits. On the onset, I want to tell you that hyaluronic acid is an integral ingredient in synovial fluid. This is the joint fluid that keeps your joints lubricated, helps to prevent arthritis, helps to prevent various joint problems. So that reason alone, hyaluronic acid is very important. What is hyaluronic acid? It's kind of it's called a GAG. I'm not even going to attempt to pronounce the full name of what that stands for, glycosaminoglycans, something like that. But glucosamine is in the same category. Glucosamine is a structural component of joints and cartilage, so it helps to build up the, let's say, the strength of joints and cartilage. Now, hyaluronic acid is compatible because what hyaluronic acid does is it retains water in the tissues, kind of pumps, it kind of like acts as a lubricant, or it kind of like more like a shock absorber, let's say. It prevents trauma to joint. It also puffs up your skin. In other words, it retains water in the skin. It's naturally produced in the body, and the largest amounts of hyaluronic acid are found in your skin, your connective tissue, and your eyes. Again, the main function is to retain water to keep the tissues lubricated and moist. It has a variety of uses. Many people take it as a supplement. They have hyaluronic acid supplements, which is probably why this viewer asked for a video on that, because it is available in supplement form, and it's usually touted as helping to relieve joint pain, and there is some truth to that. It actually can be absorbed and actually reduce joint pain to a certain extent, and maybe even a little tendonitis. It's also available in topical serums, as in eye drops, and as injections. It's often injected in the knee. I was going to get it myself. I have knee arthritis. Lou Ferrigno, a couple other famous bodybuilders have had hyaluronic injections. Basically, when you have arthritis, very often the cartilage is just shaved away. There's no cartilage left in the knees. This can cause knee pain. When you inject the hyaluronic acid, it's available under various brand names. It actually, the fluid gets in the joint and it kind of prevents the rubbing of the cartilages together, so there's much less pain. I'll talk a little bit more about that later. But the thing is, about half of the hyaluronic acid in your body is present in the skin, about 50%, and there it binds to water to retain moisture. As you get older, you don't produce, like a lot of other things. As you get older, you don't produce a lot of your production of hyaluronic acid tends to decrease. This tends to make the skin drier. It also contributes to the appearance of wrinkles and fine lines on the face. The natural aging process and exposure to things like UV radiation from the sun, tobacco smoke, and pollution, it can also decrease the amounts of hyaluronic acid in the skin. Taking hyaluronic acid supplements can prevent the decline by giving your body a little bit of extra amounts to incorporate in the skin, kind of to replace what is being, let's say, not produced in the body or lost through sun exposure, that type of thing. The doses they use, 120 to 240 milligrams per day for at least a month, have been shown to significantly increase skin moisture and reduce dry skin in adults. Hydrated skin, as I said, also reduces the appearance of wrinkles, which may explain why several studies show that supplementing hyaluronic acid can make the skin appear smoother. When applied to the surface of the skin, hyaluronic acid serums can reduce wrinkles, redness, and dermatitis, or inflammation of the skin. Some dermatologists even inject hyaluronic acid fillers to keep the skin looking firm and youthful. A lot of your celebrities and movie stars get regular hyaluronic acid injections from dermatologists, Beverly Hills dermatologists, or whatever, because it gets rid of a lot of the fine lines and wrinkles, makes them look a lot younger than their chronological age. They also get stuff like Botox, a lot of plastic surgery. But, look, anytime you see a movie star that's 75 years old and has the skin of a woman 30, she's had a lot of work. I mean, I don't have to tell you guys that, do I? Anyway, hyaluronic acid also plays a key role in wound healing. It's naturally present in the skin, but its concentrations increase when there's damage. In other words, when you damage the skin, your body tends to produce extra hyaluronic acid because it speeds the healing of wounds by regulating, lowering inflammation levels in the skin and signaling the body that to build more blood vessels in the damaged area. That's how it helps skin healing. Applying it to skin wounds has been shown to reduce the size of wounds and decrease pain faster than a placebo or no treatment at all. So there is some science background to the effectiveness of hyaluronic acid in treating skin wounds. It really works. Hyaluronic acid also has antibacterial properties, so it can help reduce the risk of infection when applied directly to open wounds. What's more, it's effective at combating gum disease. It speeds up the healing after tooth surgery, and it eliminates mouth ulcers when used topically in the mouth. Like if you get these, what are they called again? I can't remember. There's a certain type of mouth ulcer that people get sometimes. If you apply hyaluronic acid to it, it actually speeds up the healing. Those things can be very painful. Those mouth ulcers, by the way. While the research on hyaluronic acid serums and gels is promising, there hasn't been any research to show whether taking the oral supplements can produce the same effects as the direct topical serums and stuff like that. It's like I say, hyaluronic acid is found in the joints, and it does keep the space between the bones lubricated. It prevents them from rubbing together, and that causes the pain of arthritis. As I said, hyaluronic acid is an integral component of the synovial fluid, better known as joint fluid. When joint fluid dries up or isn't produced in sufficient quantities, you've got arthritis in any part of the body, any joint of the body. If the synovial fluid goes, it's kind of like running a car without oil. What happens if you run a car without oil? Boom, you destroy the pistons or whatever. That's what happens in your joints without synovial fluid. So you can look at synovial fluid as the kind of oil for your joints that's needed. And hyaluronic acid helps increase synovial fluid or maintain it. Hyaluronic acid supplements are, because of that reason, very good for people with osteoarthritis. Taking 80 to 200 milligrams for at least two months has been shown to significantly decrease knee pain in people with osteoarthritis, especially older people between the ages of 40 and 70. I can also, as I said earlier, there is a form of hyaluronic acid therapy where it's injected directly in the joints for pain relief. But an analysis of 12,000 adults found only a modest reduction in pain and greater risk of adverse effects. And it's for this reason that I tried to get HA injections myself after I heard that Lou Ferrigno and a couple other people got it and claimed that it helped them a lot. I went to an orthopedic surgeon who, by the way, stunk out loud for reasons I won't get into. Some doctors are better than others. This guy was absolutely terrible. He told me my insurance wouldn't cover it, but I could get it done at a cost of $800, and I went for it. And then for some reason he said it had to be approved anyway, by the insurance company, and he never followed through. So I never did get the injections. Needless to say, I changed doctors. This guy, if there was a list of the worst doctors in the world, he'd be on that list. He's a Marina Del Rey orthopedic surgeon. If you're watching this doc, you stink. Anyway, some research shows that pairing oral hyaluronic acid supplements with injections can help extend pain-relieving benefits and increase the amount of time between shots. So if you are taking the shots and you take the oral supplements, it can actually make the hyaluronic acid injections last longer, because normally they only last a couple of months. I think you have to take them about twice a year, if I recall. I don't know exactly, but I know they don't last forever. They have to be supplemented regularly. But if you take the hyaluronic acid, let's say supplement, it extends the time. It works well with the injections. Some new research shows that hyaluronic acid supplements can help reduce symptoms of acid reflux, where acid reflux means when the contents of the stomach are regurgitated up into the esophagus. It can cause pain and damage to the lining of the esophagus. It turns out hyaluronic acid may help soothe the damaged lining of the esophagus and speed up the recovery process. A test tube study, also called in vitro, found that applying a mixture of hyaluronic acid and chondroitin sulfate to the acid-damaged throat tissue helped it heal much faster than when no treatment was used. Human studies have also shown benefits in this regard. A study found that taking a hyaluronic acid and chondroitin sulfate supplement along with acid-reducing medication, decrease reflux symptoms 60% more than taking acid-reducing medication alone. And if you could cut down the amount of acid-reducing medication, such as protein pump inhibitors, that would be a very good thing. Protein pump inhibitors are among the worst drugs you can eat. You can ingest, because they're associated with a number of serious diseases, including heart disease. So if you can avoid taking protein pump inhibitors, you do yourself a service, believe me. A second study showed that the same hyaluronic acid supplements were 5 times more effective at reducing acid reflux symptoms compared to a placebo. So it seems to really work in that regard. About 1 out of 7 older Americans get something called dry eye due to, again, here we go again, reduced production of tear. Everything slows down when you get older. Trust me, I'm older. It's like Betty Davis said, aging is not for sissies. Trust me, it's true. No matter what you do, no matter how many supplements you take, no matter how much you exercise, there's going to be changes that you have to deal with when you get older. Doesn't mean you're going to get screwed up or you can't walk. That's up to you. You have the preemptive ability to avoid a bad older age by eating right, exercising, that stuff. But things are going to change. I can't lift the weights that I used to lift in the gym. I can't lift heavy weights. If I try, everything falls apart. But who cares, At my age, do I really want 22-inch arms? What for? What do I need 28-inch thighs for? I'm talking to you older guys now. You can have a nice physique when you get older, but don't try and look like the younger guys. Don't try and get like 20-inch arm. You're just going to screw yourselves up. Trust me on that. I'm being honest with you. Now, getting back to the dry eye, because hyaluronic acid is really good at retaining moisture. It's used to treat dry eyes. In fact, a study showing that eye drops containing 0.2 to 0.4% hyaluronic acid has been shown to reduce dry eye symptoms and improve eye health. Contact lenses that contain slow-release hyaluronic acid are also being developed as a possible treatment for dry eyes, because dry eyes is a major side effect of wearing contact lenses for extended times. As anyone who wears contact lenses already knows that. In addition, hyaluronic acid eye drops are frequently used during eye surgery to reduce inflammation and speed wound healing. When applying them directly to the eyes, has been shown to reduce, while applying the eye drops of hyaluronic acid directly to the eye, has been shown to reduce dry eye symptoms and improve overall eye health. Nobody really knows if the oral supplements are capable of doing the real thing. That hasn't been tested yet. So I don't know. I'm not sure about that. There's some new animal research that shows that hyaluronic acid could be beneficial to bone health. 2 studies have found that hyaluronic acid supplements can help slow the rate of bone loss in rats that have osteopenia, which is a loss of bone mass. It's the first stage of osteoporosis. That is a thinning of the bones that very often occurs in older women. In women, it's usually related to a lack of estrogen and also weight-bearing exercise. The women who usually get osteoporosis are smaller and have small bones that are more prone to osteoporosis. But hyaluronic acid may help that, according to the animal studies. Again, they have test tube studies, which, again, I don't like to even talk about. In vitro test tube studies, they're very preliminary. Sometimes they don't really pan out in human physiology, but keeping that in mind, test tube studies have shown that high doses of hyaluronic acid can increase the activity of osteoclasts. These are cells that build up bone, osteoclasts, and they oppose osteoclasts. Osteoclasts tear down bone mass, osteoblasts build them up. Hyaluronic acid favors the production of osteoblasts, which will maintain bone mass. I'm not going to lie to you, there's no human research on this. Right now, it's hypothetical based on what's known about hyaluronic acid, how it works in test tubes in animals. Speaking of women, about 3 to 6% of women suffer from a condition called interstitial cystitis. It's a painful bladder syndrome. It can cause abdominal pain, tenderness, and also a strong and frequent urge to urinate. Nobody really knows the cause, but hyaluronic acid has been found to help relieve the pain and urinary frequency when inserted directly in the bladder through a catheter, which I don't think will be that popular with women. By the way, DMSO, the old stuff DMSO, which was also used in the 70s, especially in the 80s, very popular for treating pain inflammation. The only actual medical indication for DMSO, the officially stated medical indication for DMSO, is also to treat interstitial cystitis. And again, probably because it relieves pain and inflammation. Nobody really knows why hyaluronic acid relieves those symptoms, but they think it could involve repair of damage to the bladder, to the bladder tissues, because hyaluronic acid does favor healing, like it does with wound healing, favors overall healing and decreased inflammation, which also increases the healing effect. Okay, what's the possible side effects? Hyaluronic acid is pretty safe to use. There's very few reported side effects. The body naturally produces it. There's very rare, allergic reactions almost never happen. There was a study in 60 people with osteoarthritis who took 200 milligrams daily for 1 year. None of them had any negative side effects whatsoever, zero. But you got to be careful with supplements when during pregnancy or breastfeeding, because some of these supplements can be transmitted through, to the fetus or through breast milk. So, because there hasn't been any studies on hyaluronic acid with pregnant women or lactating women, I don't think it should be used by pregnant women or lactating women, because again, there's no information on it. Why take a chance? There's also some evidence that cancer cells are a little bit sensitive to hyaluronic acid, and theoretically, taking hyaluronic acid supplements may make some types of cancer cells spread faster. This has not been observed in any humans, to my knowledge, whatsoever. It's just a theoretical possibility because of what hyaluronic acid does in the body, but I don't think it's ever been actually shown to occur in a person with cancer. However, sometimes, it may be prudent if you already have cancer, don't take hyaluronic acid just to be safe, just in case. The biggest risk with the hyaluronic acid comes from the injections. It's usually related more to the injection procedure rather than the hyaluronic acid. Some people get a little sensitive. It can happen with any kind of injection, testosterone or anything else, growth hormone. It's just a sensitivity to injections. It's not really the hyaluronic acid. And that's about it for hyaluronic acid. Again, it's a supplement that really works for certain things. Wound healing. It'll plump up your skin. It'll help some wrinkles. It's probably good for the joints if you're having some joint pain, arthritis. It's going to increase the fluid in the joints, assuming that your joints can still make fluid. I don't think mine can. But anyway, let's say you're in the early stages of osteoarthritis. I think that hyaluronic acid could possibly be a benefit. And again, if you're worried about aging effects, wrinkles, and that stuff, the hyaluronic acid probably would also be useful for that too. So if you want further information about nutrition, supplements, exercise science, ergogenic aids, hormonal therapy, anti-aging techniques, fat loss techniques that work, women's health and fitness, subscribe today to my Applied Metabolics newsletter. It's 40 to 50 pages every month. No advertisements, evidence-based. It includes my, it's going on 58 years of empirical and academic experience. I include everything I've known and learned over the years into my newsletter, so it'll help you avoid a lot of mistakes. It'll help you from spending your money on worthless supplements that don't work, because I am not associated with any supplement company, unlike a lot of people that make these YouTube videos that are either selling their own supplements or are under contract to supplement companies. I have no axe to grind. I'm going to tell you the truth. I'm just like you. I want to know the truth. I want to know what works and what doesn't work, and I'm going to tell you what that is in my Applied Metabolics newsletter. It comes out on the first of the month, every month, 40 to 50 pages again. I shouldn't have called it a newsletter. It's more like a digest or something, because it's much longer. Yeah, a newsletter is crap. It's usually 1 or 2 pages of absolute useless crap. My newsletter is loaded with information, loaded with it. I guarantee you, no matter what your level of education, you'll learn something. I don't care how many PhDs you have. You will learn something from every issue, because I include the latest research that's really hard to keep up to. I scour literally hundreds of journals each month and other science sources to come up with information and practical information that I write about in my Applied Metabolics newsletter. I prefer to write about things that you can use now rather than hypothetical situations. I come across a lot of interesting medical and scientific information that is interesting but really has no practical use, so I kind of not write about them, or if I do, I just mention them in passing. I want to write about stuff that you can use that's practical. That's why I call it Applied Metabolics. So subscribe today. www.appliedmetabolics.com. When you subscribe to Applied Metabolics, I'll send you an invitation to join my private Applied Metabolics Facebook page. Every day I post new information on medical scientific topics. Very interesting stuff. I also answer questions on the Applied Metabolics private Facebook page. I also have an email portal on the Applied Metabolics website, strictly for subscribers, current subscribers only. I will not subscribe. I will not answer unsolicited questions sent to me through my Applied Metabolics site. It's reserved only for subscribers. You're welcome to leave comments under these videos. Sometimes I'll answer them, sometimes I won't. It all depends on the time. But also you could leave suggestions. This video, for example, somebody asked me to do a video on hyaluronic acid. Here it is. So I do, if I think the suggestion is rational and I think that it would interest more than 2 people, then I'll do a video on. I'll try to do a video on it. And again, it'll be unbiased information. I'm not trying to sell anything. I didn't even mention the hyaluronic acid injection product names for that reason. There's about 5 of them, though. You can look it up yourself. So that's about it. If you want to have the best friend you'll ever have, go to your local shelter, adopt a dog. They are the greatest dogs. And by the way, speaking of arthritis, a tip for you people that already have dogs, don't let your dog get fat. Don't let your dog get overweight, because overweight dogs, fat dogs, they always get arthritis. It cripples them. You know, if you go to the vet, they'll try and put you on these non-steroidal anti-inflammatory medications for dogs that destroy the dog's kidneys and eventually kill them. Do everything you can to keep your dog slim. You know, if you have to go out and walk them 10 times a day, run them, don't give them junk food. Don't give them high carbohydrate dog foods, which make them fat as a house. A lot of the commercial dog foods are just loaded with carbs. You know, unless your dog is super active, he or she is going to get fat from that. Don't do it. Don't fall for that crap. Anyway, take care. Thank you for listening.